Opioids are often used to relieve pain for patients with advanced cancers. However, an epidemic of opioid misuse has led to strict regulations on opioid prescription and adoption of urine drug screening for patients on opioid therapy. This can potentially deprive and harm cancer patients near the end of their life, especially patients from historically disadvantaged racial and ethnic minority backgrounds. In a study published in the Journal of Clinical Oncology, researchers in the U.S. investigated the trends in racial and ethnic disparities in opioid access and urine drug screening frequencies among patients with poor prognosis cancers near the end of life. The study analyzed data on white, Black, and Hispanic Medicare patients older than 65 years who died between 2007 and 2019 due to cancer. The study found that, in addition to a drastic decline in end-of-life opioid usage and increase in urine drug screening since 2007, there were also significant racial disparities in both measures. Compared to white patients near the end of life, Black and Hispanic patients were less likely to receive opioids and were typically also given lower dosages. In addition, Black patients were more likely than white patients to undergo urine drug screening. Overall, Black men were disproportionately impacted by these disparities and were least likely to receive opioids, receive the lowest doses, and were most likely to undergo urine drug screening. These racial and ethnic disparities were independent of demographic and clinical characteristics and persisted even after adjusting for socioeconomic factors such as poverty and where patients lived. These findings point towards racial bias or structural racism as potential causes of inequalities in access to prescription opioids near end of life. This has likely resulted in inferior pain management and heightened suffering for Black and Hispanic patients in their final days. It is important that clinicians and the healthcare system be more mindful of these disparities and take urgent and necessary actions to mitigate them.